Well, I first wanted to thank everyone for joining us, and thank you, Tiffany, for joining as well as a speaker for our June summer discussion series. Tiffany is going to be talking a little bit about today navigating healthcare as your own advocate, a guide for busy women. With over 10 years of experience, she believes that everyone deserves great healthcare and that navigating the system shouldn't require a medical degree. So I am going to turn it over to Tiffany.
Thank you so much, kindly, Savannah. I am delighted to be with you all with your RV Women's Alliance community. Today, I will be sharing on the topic of navigating healthcare as our own advocates, right? So, here we are all busy women, and today I hope that you will find some value in this time that you've carved out for yourself. Again, my name is Tiffany Kuo, and I will be going through some presentation material for our time together. I will allocate a bit of time towards the end if you do have any interest in engaging a bit more, feel free to do so then. But throughout the presentation, feel free to pop into the chat your insights, any questions, comments you have. And even as you're joining in today, as we have folks coming in, feel free to share where you're calling in from. Myself, I am just outside of the Washington, D.C. area. So again, it's a pleasure to be with you. And as we get started here, I want you to all feel free to comment in the chat if you have ever left a doctor's appointment and realized that maybe you just forgot to ask something important, or you felt like you really weren't even heard. Well, you are not alone, and it is not your fault. In fact, the healthcare system was not designed with busy working women in mind. I have spent over a decade working inside healthcare organizations, building quality improvement programs, designing products with and for providers and caregivers, and researching what patients need. In addition, I am an integrative healthcare practitioner, and I have worked directly with patients, bringing in integrative approaches such as yoga, mind-body therapeutics, and breathwork to our communities. I'm going to be sharing with you insider knowledge on how to navigate the system so that you get the care that you deserve. So we have a lot of ground to cover. Today, I like to highlight a few points. We're going to be covering our US landscape here. I think many of us are coming and calling in from the US. And I want to emphasize with a primary women audience here, a bit more focus on the woman's health experience and our experiences with healthcare. In addition, I would like to level set a bit on our expectations for our health and also that of the medical system. So we'll be going through some distinctions there. And I do bring this insider perspective on how the system actually works and how we can work with it in order to get better care. So I promise by the end of today, you will have the practical tools to prepare for your doctor's appointments, to ask those right questions, and to advocate yourself. In addition, we'll be engaging in a bit of self-care practice that is rooted in lifestyle medicine. So I hope that sounds good for everyone here. I will go ahead and get started with starting out with a bit of context here. So, from a contextual standpoint, our healthcare system is facing extreme pressure and challenge. Currently, our providers, in other words, our clinicians, the doctors and nurses, as well as our insurers in this landscape, face extreme pressure with doing more with less. There are some macro trends that we see in the industry. For one, we see rising costs. Perhaps we've heard this in the news. And the reason for this is that there are demographic shifts across the industry. We are seeing aging populations. The boomers are coming about. We have chronic conditions. Many of us maybe live with 2+ chronic conditions. And there's a workforce shortage. So that is that our providers, there's not enough providers necessarily to take care of our population. Moreover, we have administrative inefficiencies. We had these reimbursement pressures because healthcare is highly regulated. And in fact, insurers get reimbursed based on what's known as a Medicare value benchmark. And so even if you have a private or employer-sponsored plan, many of us here do, that's directly linked to what amounts are paid for what services. And so what might our experiences be like, right? Why is it that we feel, anybody can resonate here, feel free to chime in, that we feel like we don't have much time with our providers, right? We only have a few minutes. And the reason for this is, in fact, multifold. For one, many offices see maybe 50 plus patients each day. And so each provider only has a few minutes with their patients. And on top of that, with women's health, there are still inequities based on the amount of services that are reimbursed. So, one simple example is for an OBGYN visit, a particular service that is comparable there versus for, let's say, an orthopedic specialist. That same type of comparable service, it'll be reimbursed at a lower rate just because it was classified according to this value scale for OBGYNs. So, there are inequities in the system. This explains all the reasons why we feel these pressures in our appointments and the experience of another trend, which is that we as patients, as consumers, there's an eroding trust. Our experience of the system with its ease of navigation, with how we're receiving care, there might be some dissatisfaction. If anybody can relate, feel free to chime in there as well. And moreover, we are seeing that there's more technology that's involved in healthcare. I've been in the health IT area, health tech sector for quite a while. So a lot of times there's efforts to improve what's known as quote unquote interoperability, which is a big fancy word for operational efficiency to improve the current workflow dynamic for providers and to support patients in getting and receiving the care that they need. And so the cost of medical advancement, the technologies all add to this overall cost, which leads to an expensive medical landscape. And so it is not an understatement that our systems are experiencing real constraints and why we feel these things as far as how our appointments are even scheduled and felt in our experience. And rather than feeling as if we're seen as a whole person and getting the care we desire, sometimes it feels like we're just classified as a diagnosis, our diagnosis code, if you will. Now, there are some shifts that are occurring, which are based on what are known as population-based payment models, where essentially we work to align incentives across the industry. So with payers, providers, and other healthcare stakeholders to provide more of a scalable delivery model with features that are more focused around care coordination, team-based, and patient-centric care, which is all of the things that we value here, right? So this is not to overwhelm us, but for us to understand that while all of this going on, we want to understand a bit about the systems and the constraints so that we can navigate with this as empowered patients and as experienced patients in navigating this ongoing system. So now that we have a bit of context on this macro, let's zoom back into the micro. So I'd like to share a story with you. There was a time when I would constantly wake in the middle of the night. Not sure if it was because I was a new mom to a young kid that was causing my disrupted sleep. But even if I tried to get back to sleep, I would find my mind is racing all over the place. I was trying to solve problems at 2 a.m. I would feel fatigue throughout my day. Even I had bouts of anxiety and depression. And to top it off, I felt as if by going to my providers, that actually they were the ones who had all the answers for my health. I would go into an appointment fearing what my lab result would be and thinking that my clinicians knew all the answers. Well, we have a tendency to expect our clinicians to be able to fix our health. And maybe we just doubt ourselves or we give our power away to these outside experts. Have you ever had a time when maybe you were overly anxious or feeling like something was quietly disrupting your inner life? And feel free to chime in here with anything that you guys might feel in your experience here, coming together as community and as women. These are some symptoms that sometimes we might have in our experience. And even if you don't see anything here specifically, whether it ranges from allergies to just not feeling our best in our body and our mind, whether it is just feeling tired or run down, right? Sometimes it's just high adrenaline. We're hyper focused, whether it be work or managing our kids, or maybe we have aging parents. It all takes a toll. And as women, these are things that we see, hear, and we quietly acknowledge. And it is important to realize that we are not broken, right? You're not broken, and your body is simply speaking a language that you haven't learned yet. So I want you to realize that. So now, what does women's health mean for you? I want to hone in a bit more since we have all of us coming together in community on this topic. And feel free to share into the chat. What is the connotation that you have when someone says, what is women's health? What do you think of? I see menopause. I hear some things in the chat, right? Feel free to chime in and engage there. Well, women's health has been perceived culturally, clinically, systematically in work and home as narrowly being defined as quote unquote reproductive care. Does that resonate for anyone as far as maybe when you think about what is women's health? And yet, women influence approximately 80% of healthcare decisions, and the conditions that affect us will affect us differently, disproportionately, or exclusively, which means that those conditions are actually chronically underfunded relative to the prevalence in the population. So, for any particular condition that affects us differently, that's something that maybe anything that ranges here, there are some types of conditions or therapeutic areas that is in the classification of women's health: cardiovascular diseases, lung cancers, metabolic disorders, mental health conditions. These are things that we will experience differently. Take one example of a heart attack, right? So for a man, it may be extreme chest pain, but for a woman, this goes undiagnosed because maybe we exhibit differently. We have the sensation of the fatigue, even jaw pain or nausea. Like it comes about a little bit differently. So that's what I mean by different experiences. Disproportionate conditions include autoimmune disease, Alzheimer's disease, osteoporosis, chronic pain, and migraines. That affects us at a higher proportion in the population relative to men. And there are some things that we just experience because we have this extra X chromosome, right? So I've heard in the chat, menopause, right? Endometriosis, pregnancy complications, ovarian cancer, just to name a few, right? So these are all examples. So now why do we care about women's health, right? As all of us here on the call, right? It goes to be said all of those reasons already, but the gender gap is real. According to McKinsey Global Institute, the health gap in terms of disability adjusted life years and the structural and systemic barriers that women face is real. And only if we just address 25% more of our time in this poor health, if we address that, we would boost our global economy $1 trillion. So there is a direct lead to economic productivity in our health. So let's let that sink in a bit here. Most of us here in the population here, maybe in the 20s to 60 sums, that is a primary burden that we experience. Women make up, in fact, 51% of the population, but globally, women live longer and in poorer health with a higher disability than men. We are 3 times more likely than men to get migraines, twice as likely to experience depression and anxiety, twice as likely to develop Alzheimer's disease, and women suffer 80% of all autoimmune diseases and osteoporosis cases. Women have a higher mortality rate after the heart attack, as I mentioned before. We're 7 times more likely to be misdiagnosed with a heart condition in the first place. And so what we're seeing is that it's not just sex-based differences, but also the context for our modern day, right? So our modern day demands, the cultural influences that surround us, that all impacts our well-being. And the experience of the stress impacting ourselves affects our work, our life, and it's actually felt, right? So maybe it's not fully expressed within the medical system. So I want you to just take that in for a moment. So the message here is that our lives are not static, right? They vary across life stages. And personally, I like to say our health span will need support and understanding at scaffolding key inflection points throughout our life. And we really ought to give ourselves a bit of grace as we move through transition periods, whether it be through perimenopause, whether it be through pregnancy and that perinatal journey to transitioning in menopause. We're all going to experience menopause, right? So there are different points in time that we will have a need for more support. Additionally, women's health research is evolving. In fact, the first clinical trials to include women was only in 1993, to the policy changes, which included only recently in 2016 that the NIH establishes sex as a biological variant in its policy. So only in 2016, that's not that long ago, right? Moreover, women's advocacy changes in legislation are evolving, and only last year, the black box warning was removed off of estradiol vaginal cream after years of fear driven by media impacts with the shadowing of Women's Health Initiative for systemic hormone therapy. So we won't get into all of those details at this time. Well, the take-home message here is that women's health experiences change over the course of our lives, and it differs from men. We need support differentially, sometimes more or less based on what we're going through. And I can say that even I think I saw my healthcare provider more in the year of my pregnancy in that journey than in the prior 10 years. So it varies quite a bit, right? All right. So with this life stage evolution, we can bring greater awareness and compassion to our cycle's social well-being. When we understand the context of being a woman in this modern era, and two, when we can address our nervous system health regulation. So first, we realize the distinctions of being a woman within the structural inequalities that exist, the presence of our role. I heard in the chat here, caregivers, right? Anybody here a caregiver? Many of us will experience this, whether it to be to kids, young kids, maybe to elders. Oftentimes, this is still left to women. In fact, I think the stats are 3 to 5 out of 5 women are caregivers. And here, as our role in work is expanding beyond the home and family, we have career demands that play a role in our overall well being. And so, how we manage our stressors can influence our health. And so, navigating care means that we really need to look at addressing our nervous system. And why do I put a fine print on here? Is because we want to find more ease, right? It's that parasympathetic rest and digest state versus being this chronic overdrive, like overwhelm. I heard that in the chat as well, this fight or flight mode, right? We really ought to be paying attention to find ways to better take care of ourselves when we can find more balance with the autonomic nervous system regulation. So we will get into this a bit more, including practices such as breath work that have clinical relevance and that help modulate this sympathetic parasympathetic balance. And it actually has actual applications for how we manage stressful situations. It helps us balance our mind, body, and our cycle physiological balance here. So now we are going to move into a bit of this aspect of caring for ourselves with a capital S, right? And also caring for ourselves as we navigate the system, right? So I mentioned the system as well. So first, there's two parts. I want you to think about it kind of in two parts. We have the self, which involves our taking care of ourselves. And as a public health person, this is something where we're focused around the environmental influences of how we receive the nutrition and we receive the experience of what we're going through in our day-to-day lives versus navigating care with our current system. And as we know, it is not quite ideal, but working through that, right? Sometimes there is, I find, also this blurring of the lines when we speak about our healthcare. We talked earlier about what health means to you, right? So there's this brokenness idea within the healthcare system. We talk about the access and cost challenges earlier. We live within this dynamic, and yet our health is not the responsibility of the medical system. So take that in for a minute as I share that, because that may be a little bit of a outrageous statement. But as medicine is shifting toward lifestyle and behavioral interventions, taking care of yourself is going to be integral to your primary and preventive care for yourself, but then also navigating the care of our existing healthcare system is part of our journey, right? So we're going through some tools through this journey. The system actually does well with more of a targeted approach. So keeping that in mind, we'll go into some of those details. All right, so let's speak a bit about lifestyle medicine. So there are some principles that are really central here. We want to focus on a healthy mind body through lifestyle approaches such as seasonal eating, getting the right nutrition for what our body needs to fuel itself, getting proper rest, identifying and treating if there are sleep problems. We want to promote consistent, adequate, good quality sleep. These are things that we can do to take care of ourselves. Now, sometimes it may not be that straightforward because we're modern demands, right? But we want to understand that these are aspects of what it means to care for the self with that capital S, right? We also want to be engaged in activities of movement, right? So whether that be aerobic exercise, resistance with those strengths, it can be anything that includes the yoga and walking. We want to combine some of these activities together. We want to reduce our sedentary time. In addition, mind-body practices, which include mindfulness, stress reduction, emotional resilience, and even community and social support are all aspects of how we can receive in the care of ourselves. So now we're hearing actually more talk about women's health as the systemic drivers that influence all aspects of a woman's experience, and in particular during midlife. So during this time, there are some life changes that occur, hormonal health, brain gut connection, even bone body and gut bone connection is being discussed more today. I was recently at the HHS Women's Inaugural Health Conference here in Washington, D.C., the first conference of women's health, by the way, and I heard many of these topics firsthand. Experts like Dr. Vonda Wright, who is a well-known and regarded orthopedic surgeon, she's on a mission to really focus on encouraging folks to engage in those strength-based activities because she's seen too many cases. She's had to operate in too many cases of those falls. So it goes to say that there are some long-term impacts here. If we focus on taking care of ourselves, we can really prevent some of those things too. Nancy Brown, who is the CEO of the American Heart Association, really is on a mission as well with heart disease as the #1 killer in women, right? So these are some of those public health topics that are rising to the top also in this aspect of our care in women's health. And the framework for lifestyle medicine is directly supportive to address all of the changes that occur for women as they move through perimenopause and menopause. And in particular, listed here, I have examples like the physical exercise, a stress reduction. I mentioned strength, right? We want a healthy plant-based diet to support insulin sensitivity, that inflammation control, gut health, right? That affects estrogen, cortisol, and other hormonal pathways, right? These are all integral. And what happens, why I'm sharing about this menopause transition is that, well, for one, if you're not going through a transition per se right now, we will all go through the transition at some point. And for women in midlife, sleep is of utmost importance because menopause-related sleep disruption can worsen brain fog and memory symptoms. So just some things to be aware of. So let's dive down more with nutrition here. So lifestyle medicine typically starts with whole food, plant predominant eating. And for perimenopause and menopause, there are practical guidelines that include more fiber, healthy fats like those omega-3s, cruciferous vegetables, adequate protein, right? And fewer processed foods, right? Fewer added sugars, right? I know we might all be guilty of this in some way, but why is this important, right? Especially during this transition. What happens is that estrogen levels start to decline. We see rising inflammation levels. We see rising insulin resistance. So lean protein can help to regulate glucose, prevent insulin resistance. And some important nutrients to prioritize as well include the magnesium to help with sleep, vitamin Bs, B12s, iron, especially during perimenopause, omega-3s I mentioned. Those are things like your sardines, your salmon, those fishes, even soybeans or leafy greens, it all includes that as well. And it's implicated, why omega-3s? It's implicated in mood and brain and inflammation processes. According to experts like Dr. Lisa Mosconi, who is a leading research neuroscientist, she's studying this now. So this is the latest research in the brain functional changes that are occurring in menopause. It is not just you, right? It's not just us. There are changes that are occurring with the function of our brains as we go through the transition. And so what she's finding is that the studies in these large cohort studies of B12 can mimic brain fog, and in some people report an early dementia, right? So it's especially important to get B12 and omega-3s. And again, the take-home message here is that Hormonal fluctuations do occur during perimenopause, and that transition will disrupt our sleep. It will affect our energy, our digestion, and food is medicine. It's globally recognized, right? My specialties are Ayurveda, which is a 5,000-year-old system of medicine that focuses on holistic, natural, preventative approaches that may be just what we might need as our body is undergoing these important transitions. So it offers a personalized approach to eating that honors your individual needs while supporting your body's natural rhythms. All right, so I'm gonna take a pause here to see if there's any questions here as I grab a drink as far as the material that we have covered thus far. I know maybe some of us are eating our lunches at this point, so take a look at what's on your plate, right? It's just awareness is really just primary as far as just being aware of what we're taking in. Certainly we might all like coffee, but I still have my coffee in the morning and all of that. So it's just becoming more aware of what we're putting into our bodies as well. Any questions from me here in the chat? Yes, I know. Breast cancer survivor here, chemo. Yes, yes. Oh, we have some Ayurveda supporters here as well, too. Wonderful to know. You guys are all chiming in here into this topic, and it's coming home for us. Well, we'll get to questions towards the end as well. We can engage in some more conversation there. I like to move on to a bit of our self-care practice a bit too. So, an adjunct to mental health care is an accessible practice that most anyone can do. I love it because it's so accessible. Evidence supports the effects of breath work as a non-pharmacological mechanisms for improving our emotional regulation and influencing what I mentioned earlier with that autonomic dysregulation, right? Which is actually a driver in many chronic conditions. And this has implications for anxiety, PTSD, chronic pain, the list goes on, and even helping with our stress reduction, right? So basically, here I have a diagram of this aspect of our amygdala in the brain. So I'm not sure if anybody here is familiar with the amygdala, but it basically activates our fight or flight response. This can be to a psychological threat. The classic example is running away from the bear, right? Many of us maybe don't run away from bears, although maybe we have some campers here, and so you're out and about. Maybe that might be the case. But with our modern pressures, right, that is something which, whether it be relationships, whether it be work, all of that anxiety, fear, anything behavioral, emotional, that all is something that can trigger our amygdala, and it is part of the limbic system. So the amygdala and the limbic system, it's important for our survival. So there is a function to this, right? And as you can see here in the image, we have amygdala and the hypothalamus, which essentially is like the regulator of the system. It regulates hunger, thirst, our hormones, etc. And it helps with um, understanding as well that we have this frontal aspect of our brain. The frontal lobe is the part of the brain that's the front of the brain. It helps to regulate when there is like an amygdala hijack. So sometimes they say, if you have young kids, it's like, oh, well, your prefrontal cortex is just not developed. Well, that's essentially true, right? They're still developing. And so the frontal cortex really helps us to calm down a bit, find some logic into what's going on, right? And we can do this simply by slowing down, taking a few deep breaths, refocusing our thoughts. This allows the frontal lobe to take over that irrational amygdala. So we'll engage in some slow diaphragmatic breathing as well, especially with those longer exhales, which will enhance our vagal activity now. So vagal tone is associated with increased heart rate variability, which is essentially the variation between your heartbeats. And this signals better stress resilience, cardiovascular health, and emotional regulation. So some of us might track whether you have like a device or a wearable, like a wearable perhaps, that you can track some of these things, and everybody's values will differ. But essentially here with heart rate variability, when the vagus nerve, it's this main nerve essentially that travels as a superhighway from the brain to the rest of the body. So by taking deep breaths, we can refocus our thoughts and calm everything down. So if you can see my hand here, imagine my hand were a brain, and this aspect of my arm is our brainstem, or that vagus nerve, which travels from the brain to the rest of the body. Well, the amygdala, pretend that's my thumb. If the amygdala is going through this hijack, where it can, right, you kind of freak out about something. If we calm the frontal cortex down, then it signals to the vagus nerve to allow my whole body to calm, find that stasis of ease. And by taking that deep, slow breath, it's signaling to the body that we're okay, we're all good, right? So I don't know if anybody has ever had that experience happen. If you have this anxiety or just really being on alert, that is essentially what is going on from a physiological perspective. All right. So now we're going to do a simple breath practice. And anybody here who has ever done breath practices themselves, don't worry. I'll be guiding us through here, but I encourage you to join in with me now. So set aside what you have, your attention here, and just start to draw your feet down to your ground as you just feel your feet resting on your ground. Take a moment, you can just relax your shoulders. I know sometimes it builds some tension up, so just roll out your shoulders a couple times, relax your head and neck a bit. And taking time to maybe invite yourself to gently close the eyes or shut the eyes. By drawing the eyes closed, it helps us to turn our attention and awareness a bit more towards ourself. So just allowing yourself to start to connect and notice your breath. So notice the inhales, notice the exhales. Without changing anything, just allow the inhales and the exhales to occur naturally here. Allow yourself to soften through your mind a bit more. Find some ease through your neck and your shoulders. Allow yourself to draw your attention to feel the support beneath you. So on your chair, perhaps, starting to draw your attention to the base of your spine. And as you allow yourself to inhale your breath, inhale the length of your spine all the way up to the crown of your head. You can draw your shoulders up to your ears, exhale the shoulders back and down. So you're going to begin to draw your back, your scapula together. Gently lean against your back. Just trust you have your own back here. A strong back, soft heart. Allow for openness through the heart. Place one hand over your chest or your heart. Place your other hand over your belly, taking your time to just allow this simple act of touch to retune your attention back to yourself. So drawing all of your attention to yourself, allow yourself to again re-notice how the breath fills into your lungs, expands into your belly. And we're going to just follow my breath count here. We're going to be inhaling and exhaling a little bit longer as we exhale. So as we inhale, we're going to count to a count of 4. Pause at the top for a count of 5. And as we exhale, we're going to release and release for a count of 6. So again, you're just inhaling to allow the breath to fill through your lungs, expand into your belly, pausing at the top for an extra count, and then exhale just to release all of it out. Again, inhale, 2, 3, 4, pause, 2, 3, 4, 5, and exhale, 2, 3, 4, 5, 6. Again, inhaling, deep breath in, filling up, 3, 4, pausing, extra count, 3, 4, 5, and then exhale to release, drawing your navel to your back and your spine. As you release, you can relax your hands back onto your thighs. Take a moment just to find that calm, neutral breath. Allowing yourself just to allow for the breath to settle. And whenever you're ready, you can gently, slowly begin to reopen your eyes. Maybe just drawing the attention of your room or space around you. Slowly starting to draw your attention and gaze perhaps back to our space here together, on your screen even. And so that is a very simple practice that you can do. Perhaps in the middle of the day, you just need a little bit of a reset. It only takes a few minutes, as you can see here. And even if, let's say, you're going to an appointment or something where it might be a little bit anxiety ridden, I like to just place my hand over my chest, a hand over my belly. Just a simple act of touch to self just returns our attention back to ourselves, back to home here. So just give yourself that tool as a breath practice that you might try for yourself. And breath practice improves vagal tone, heart rate variability, signaling that better stress resilience, cardiovascular health, and emotional regulation. So I'd love to hear if anybody has had any experience with that breath practice. Feel free to share into the chat and just see if there's anything that has landed for you, or I'll scroll here. Yeah, sometimes it just takes a moment just to reconnect back to ourselves. And the breath is a great way to do that because it really just brings our attention back to the present moment, right? Maybe sometimes we're thinking about the future, we're worrying about the past, right? So deep breathing, right? It's a great reminder. I love it. Okay, awesome. You guys were fantastic. Thank you so much for sharing. Love to hear the experiences there. All right, so now part two. Well, I appreciate the lifestyle medicine framework, which doesn't just emphasize our individual role in our health. We're going to now move and zoom back out into the system. A recent framework from the American College of Lifestyle Medicine describes that there are 9 essential elements of an effective lifestyle medicine care system. One that is accessible. It is affordable, offered in many settings, from health systems to communities to workplaces and schools. It is comprehensive. It expands prevention to treatment to acute or physical, behavioral, social needs. It is high quality. So it's really focused on those outcomes that matter to us, that align with our patient values, right? And also, it is integrated and whole person, really thinking about us as a whole being. Moreover, it is accountable and aligned within this value-based approach with the reimbursement that I mentioned earlier as well, with the infrastructure that really prioritizes that. It's cost effective, it's equitable, and it is achievable to be delivered in multiple settings. So, what I have seen through my work is that these efforts across the healthcare entities who are prioritizing these elements, it makes a difference, right? And today we will emphasize what role we can take as advocates of our own care. So, the evolution of healthcare payment models in the US is complex. And as healthcare delivery systems are shifting, we must align on these high quality, accessible, and affordable care models for all Americans, for all of us, right? The key is really to stay informed and advocate for the comprehensive, coordinated care that treats you as a whole person and not just a collection of billable services, right? And there are some tips for engagement. I like to align with the Society for Participatory Medicine. I've written articles for them as well there. And essentially, some tips for engagement include remembering that you are an expert on you. Combine your body and your symptoms with the expertise of your medical providers. So, really, this combination partnership works best. Additionally, the system favors those who are prepared. So a proactive, organized approach as a patient helps for you to get your best results. So work with the system in this way. Additionally, you want to voice your concerns. So expect to be heard. Engage in what's called shared decision making, which is essentially prioritizing you as a center of care, remembering that that's what's going on and that you're engaging and partnering with your care team in this process. Also, be direct about your outcomes. Tell your providers what health outcomes matter to you, right? So, really voice that out. So, clinicians are actually working within the context of their own metrics. So, they got checklists, they have guidelines they need to follow, they have knowledge, right? And we can work together with them in this partnership model, right? So providers go into practice remembering this. Remember that providers go into practice desiring to help. They are there to help us, right? And so I like to share a preparation framework, which I call the 3 Ps, in order to help you prepare for your appointments. First, we must prepare information on hand. So this can be in your electronic health record. Some of us may have access to that if you keep your records there. You want to know your medical history. You want to think about your preparation about what types of um, hospitalizations you had recently, any family history, any current symptoms. And as you track any symptoms, it's helpful to keep it very concise. So detail like the start, the frequency, how it impacts you. For instance, I've had headaches 3 or 4 times over the past week, and it's occurred in the past month more recently, typically in the afternoon. Ibuprofen helps, and it does impact my work. So something like that. Next, we must prioritize. So what are we going to prioritize? We're going to prioritize what is meaningful for you. So a framework that you can use is thinking about what is most urgent for you. What is something that is time sensitive? Remember, we only have those few minutes, right? And so thinking about getting clarity on that can be helpful. So prioritize your list. And the prep sheet is something that will summarize all of your information. So think about what you want to have on that sheet that will be helping you during the conversation or meeting, for instance. You can prepare questions about your diagnosis, your treatment, all of that. One powerful question you might ask is connecting and relating to your provider. So, what would you recommend if you were my daughter or mother, sister? Have that connection there a bit. And also get clarity. Never hesitate to ask, can you explain that perhaps in simpler terms? So, really expect to be heard. All right, let's see how we're doing here on our time. We have a few more slides to go. So, so here is just that illustration of our appointment prep sheet. Just as you prepare for notes for any other meeting or appointment you have, lead with your values, what's important to you here, what outcomes matter to you, because you might only have those few minutes. And clinicians will be tracking other things that I mentioned. So this is a good framework for you to identify those priorities, put your current symptoms, any meds, changes, and what's important for you. One example might be, I really am looking for non-invasive procedures. I really would like to walk to be able to see my grandkids, something like that. Just communicate, and listen for those next steps. Don't be afraid to ask if you don't understand. And now after the appointment, right? So as with prep, just as important as after your visit, next steps are important. So get clarity on anything you don't understand. You can refer to your nurses, you can set up follow-up appointments. You don't have to get it all done in that one appointment. You can set up other appointments. You want to take charge of your learning. And if it's helpful, find a way to document what's important. Use the EHR if you have access to that. Stay organized, however helps you. And as professional women, we know that in order to get things done, we must follow up, right? That is key. So be sure you actually follow through. And some tips just to help with this is just do it right then. Put it on your calendar. Get that prescription, pick it up, right? Healthcare has become a family affair, right? We know that 80% of healthcare falls onto the woman. And so we really need to track. We need to track our own health files. We want to utilize support system, including those EHRs, or maybe your own computer or folder you have, print if you choose, some of these things you can do to help build your health file. Any questions for me here? All right, so your healthcare advocacy action plan. So again, our key takeaways for today are is that we must prepare and use this framework can be helpful. I like to think about self-advocacy within the context of that shared partnership, right? So following up is key and ensuring that we have the next steps. Check what you need. It's important to emphasize that we realize we need support, right, during different stages of our lives. And so there's no shame, right? Sometimes we're more vulnerable. We need an extra person. You can bring someone to your appointments. I didn't mention that earlier. Perhaps someone that can listen if you're in a vulnerable state or maybe not emotionally as able to take in. It can be a lot of information sometimes. Similarly, we can also reciprocate and do that for a close other as well too. So feel free to engage and build community in ways that will be supportive for you and your family or other close loved ones. It can be emotional, difficult times sometimes. So starting today, be sure to check your screening visits, be sure to update your medications. You can review your insurers, schedule any overdue appointments. So just really take charge of your health. And ask like a healthcare insider. So I want to provide you with some essential questions here. This is a framework that I put based on buckets of questions. So if you have a question, for instance, on your diagnosis or your assessment, note functions. Um, Sometimes we're not clear about, what is going on. And so ask clarifying questions. What else could this be? What's causing it? What's going on? Just feel free to have that conversation with your clinicians, whether it be treatment, what options do I have? Understand the benefits versus risk. How well is this working? Ask from your perspective what you're looking for. Doctors don't always talk through their clinical rationale and thinking, so just become aware of that as well. And then with regard to medications, the details of your medications, what's expected in your experience? What are those pharmacological side effects? Maybe you're taking something else, like a herb or something else that's not in the conventional treatment. Be sure to mention some of these things, right? And if it's lifestyle prevention, what can you do in your day-to-day life? If you're noticing any symptoms, how can you prevent this from occurring again, right? And of course, next steps on follow-up. Always ask these. Ask about follow-ups. What are the next steps? What should you be looking out for? Where do I go if questions come up? What do I need to watch for if anything changes in the course of my treatment? I love the comments in the chat. So thank you all for sharing. Feel free to chime in as well if you find that there's been anything that's supportive in the questions here, or if anything that you find has been helpful as you're navigating through your care. All right. Well, we want to embrace our self-advocacy journey, and this is a self-awareness practice as well. We want to empower ourselves. And breath is life energy. It is our connection to our vitality. So I hope you also took that away, that breath can be very supportive in our practice and in our journey. And with that, I want to thank you all very much for your kind attention. Thank you, RV Women's Alliance, for inviting me to your excellent summer discussion series. And I invite you to connect with me. I'm on LinkedIn. Feel free to connect there. In addition, visit Design Health for Her for a free Empowered Women's Healthcare Guide, where I cover a lot of what we touched on today. So that's absolutely free to you, just as a resource for you if you find this to be of value and helpful. Again, thank you very much. I certainly would love to see if we have a few minutes here to take any shares or questions, any takeaways that you might have. So I will stop sharing there, and I will feel free to come onto screen if there is something you like to voice here in our community. Again, I like to build community, so anything that you feel open to share. We are a group of women that we are supporting one another here, and I will also take a look in the chat if there's anything here for me. Yeah, so we do have more, I think, questions coming about instances of the doctors asking Chat GPT. Oh, that's interesting. Okay. So, AI is also being disseminated in various ways now, right? So we can leverage AI in some capacity, but realizing that as well, this is an evolving space. And this is a conversation that occurs across the industry, which people are kind of exploring a bit more on as well, too. So the challenge also is that the regulations around that are not very easy because AI is advancing at a faster pace than what we're able to consider what would be human appropriateness and really caring and kind and how we actually think about how we use AI. And so there are various use cases of how this can be used. But certainly, I think now we all have access to information. So we can use our information in a way that can be empowering for us, right? So if there's something that you don't understand, there are certainly aspects of your research that you might conduct for yourself. And as you engage, with understanding more about your condition, that could be helpful for you to have some context as you're going into conversations with your providers too. Let's see here. Any other questions that we have? Feel free to come on camera as well so that you can connect with me. I see. If you're not happy with your providers, then yes. So sometimes, if you find that there's not a close resonance with a provider. We have empowered choices as well too. So perhaps you find that someone is not listening or understanding where you're coming from. Certainly find a second opinion, find someone else. There's not necessarily a need to stick with any particular provider. I remember my OBGYN, I had found her in one of my first visits when I was pregnant, and then she moved to a different office, and I actually hunted her down because I loved her so much. And so, sometimes it goes the other way around too, that you really want to find someone that you can really connect with, and sometimes you might need to go out of your way a little bit. Let's see. Second opinions, yes, absolutely. Okay. It's disappointing when your healthcare provider also female doesn't believe you. Uh, yeah. So yeah, as I mentioned with the women's health space as well too, this is an evolving area. So one of the challenges in the industry is that women's health, as I mentioned earlier, has been systematically seen as this reproductive care. And so we think of like our OBGYNs knowing everything. But even in menopause, for instance, I'm part of a women's advocacy group, and there we are working towards bringing in more need for understanding the educational reasons for why we want to educate providers on this topic. They actually only get like 6 hours per se of menopause education. And so finding a certified menopause practitioner can be helpful sometimes there. And recognizing that your providers may not have all the latest information. There are some new things that are coming about with the technologies, whatever that may be. Sometimes the clinician may not be up to date on everything as well. Yeah, and you know what? The languaging as well, mentioning here about somebody mentioned in the chat about just the procedures that you have. I've seen some articles as well about just the way providers can communicate. And sometimes I feel as if, there could be a little bit more compassion to how we speak about our experiences. And if we're getting a procedure, for instance, having a bit more compassion in these areas on, what it might actually feel like, or just the way we talk, like if you're older and giving birth or having a pregnancy journey, it's kind of termed like a geriatric pregnancy. It's interesting that some of these things we will encounter in our experience in women's health. And so again, I think for us as advocates, we can really be empowered to decide that maybe this provider isn't necessarily hearing me. And so I can look for somebody else. I can find other people to be supportive in my community. As I mentioned, I'm an integrative practitioner, so I also do appreciate approaches that if you do have access, so sometimes this is insurer based, but aspects that are quote unquote alternative, although I don't find them alternative myself, is acupuncture is even being considered more so from a holistic angle as well too. So even in my journey, I had what's known as PUPS, which is this rash that occurs on my belly. And the acupuncture, I didn't have to be put on these steroids. So that was miraculous to me. And, who knows necessarily where you're going to be receiving your support. So really reach out and find ways to receive the support that you need. Wonderful to see that you work for the preeclampsia nonprofit, right? There are definitely a lot of disparities across healthcare as a whole, but I prioritize as well our community here as women, and sometimes there are even just situations or conditions where whether it be systemic as far as the structural inequalities that I mentioned to actually the research behind what we're learning about when certain types of conditions might occur at a different rate based on different types of populations. That is definitely true. Yes, that's a big challenge as well, as far as finding your specialist. And the interesting thing is not, maybe it's not interesting in the sense of the space of women's health, is there are conglomerations of symptoms that we might experience. And again, not all providers are fully educated on just the idea about a holistic aspect of how our hormones can impact different areas of our lives, and with different subspecialties, this is something where you might see like hopping around to find your specialist, and you don't even really have an answer. So it can be frustrating. I can hear you on that. to really need to find a specialist to help you in that support. And it looks like she moved to some Eastern medicine approaches. Yeah, I've also seen that there are other practitioners who might have some different ways of looking at whether it be functional medicine, which focuses a little bit more on holistic as well as integrating practices of the Western medicine approach to care. They may have a bit more knowledge in that space. If you want to look for a functional medicine practitioner or someone who's a Chinese medicine practitioner, there are some different ways of looking at our system as well too. Okay, well, I think we just have another minute or two before we wrap up here. So again, thank you all very much for joining with me today. Thank you, Savannah, for hosting, and I appreciate you all, and I really am grateful for the time that we had today.